Hello, Mr. Al-Tahir.
Yes.
How that you choose University Rehabilitation Institute, Soja?
First of all, my brother, he had stroke before 4 months, and when he had it, he is in Kuwait. Then we'll take him to the place in Kuwait, what making therapists there, you know, specialized for therapists, you know, in Kuwait. And it's my cousin there, Dr. Abdullah Ayada, he's there, you know, and he told us, you know.
He's working there.
Yeah, he was working there before. And then we'll go there. Then they making therapies for my brother there. We spend around 2 months there. And in the 2 months, you know, it's become better, but it's not fast as what we want. That's why he prefer, you know, to come to this therapist here in the University of Socha, and then we're making all these things, and visa and all this, you know, and all we have all information about, you know, what they gonna do for him, you know, from the first, you know, until the end.
How is your brother satisfied with therapy?
My brother, before he had stroke 4 times in Kuwait. Then we take it to the Thailand. You know, he spent for 2 weeks there, you know, and he returned back. When he returned back, you know, he had another stroke. It's 5 in Kuwait. Then we decide, you know, to bring him to Socha here, you know, for the therapist, because here specialized for to have the man as a baby. They treat him as a baby from the beginning for everything, not just for a therapist. This is very important for us, and it's here is different. It's a hospital. My brother, he had sugar, and he had pressure and something like this, you know.
High pressure.
And high pressure, yes. It need him to treat him from the doctors. That's why we are bringing here, you know, for the doctor to treat him and physiotherapy to get. That's why we bring him here, you know, and to have all these things.
And how he is satisfied with the therapy?
He is very good satisfied for the therapy. Here the people, first the people how they treat him. This is very nice people, what we have. We don't have anyone, you know, he is give us excuse or something like. Everybody here, they want to help us. That's why this is very important.
Yes,
you know, to have 2 months now, and we're gonna have 3 months, you know, for the therapist here.
Have you been in some other rehabilitation centers before?
I have been to Czechoslovakia. Czechoslovakia is different.
In the Czech
In the
Republic,
Czech, yes, Czech Republic.
Yes.
It's different. It's not the type for the man who had, you know, he doesn't speak, okay, and he wants somebody, you know, to teach him how to speak, how to follow them, and to do all this, you know. These people, you know, they take him to the therapist. You doing everything for him. This is the difference. There's too much difference for this one.
Okay. Where do you see the most improvement your brother has made here at Rehabilitation Center Socha?
He cannot move his hand there.
He couldn't.
He couldn't. He couldn't moving his hand. Moving his hand. Here. Now he's moving his hand. He eat with his hand some, you know, and it's very, very, very nice. You know, this is for his hand,
Yes.
and especially for his leg.
Yes.
His leg, he cannot moving from the chair there.
Okay.
From the bed.
So he
Now-
couldn't there.
Yeah,
Yes.
he couldn't there in Kuwait. He moving for this.
How it's now?
Now he moving. You know, he moving to there. You know, they treat him for how to walk. You know, he walk very nice
Yes.
for these things, and it's very nice.
Have you managed to make some tourist trip?
Well, I have two little places for here because you know I am always you know with my brother.
You are
I
helping
can't. Yes.
your brother.
Yes, I'm helping my brother. I cannot leave him alone. That's why you know just I go for jogging, just for 1 hour or something you know and come. I went to the yesterday. I went to the center. You know it's very nice. Just one of the therapy they told us you can go straight and you can see the river there. It's near the river. It's very nice.
Nice.
They have a lot of people. You know they sitting. They have. They smoking shisha and this is the first time, you know.
We know that the food in Kuwait is very different to the food in Europe. Our chief does his best to meet the taste of Arab patients. How successful is he?
Well, if you're talking about the food, now I am here more than 2 months. And I am good cooker. Because always, you know, I'm going with my boat. Always, you know, to the sea, you know, and cooking all this. But he is excellent man who doing all this. He do fish for us, everything. We don't say, you know, it's different for the food is here or our countries.
So you like the food here?
Yes, I love the food here. I love the food here, yes.
Okay. It's nice to hear it.
Yes.
In Kuwait, people like to tell stories about their experience to friends and relatives. What you will tell your friends about these 3 months you spent here in Slovenia?
I'm going to tell them everything nice what I have it here. Even I don't have anything is not nice. People, I'm going to tell them about the people. I'm going to about the doctors here, how treat, you know, the nurses, what they doing for the patient. It's their patient, which means from their family. They treat him as a family. That's very important things, you know, for the people who is coming from any country, you know, to this country, you know, for treatment, all these things. What you need? Need people good, treat you good. They do everything for you. That is why, you know, I prefer, you know, to everybody who is in my country to come to this country to see how is the people they going to. I mean, to help them to do all these things with them. It's very nice. It's very, very, very nice people here.
Mr. Tahir, it's nice to hear it. Thank you very much. Have a nice trip and pleasant trip to Kuwait.
You're welcome. You're welcome. Thank you for